Hello everyone, my name is Nelson Min. I'm a specialty course faculty instructor with Aspire, and today I'm going to teach you a treatment for dry needling for the gastrocs. The gastrocs play a very important role in the gait cycle. First, consider how many heel raises you can do consecutively, anywhere from 2 to maybe 4 dozen before your gastrocs are exhausted. But because the gastrocs attach above the knee joint, on the posterior femur and on the femoral condyles, this creates tension along its entire length as you approach knee extension during the terminal stance of gait. Because of this, it enables you to perform hundreds, if not thousands of steps daily. Furthermore, as explained by Quo and Lombard, the reverse is true. As you approach weight-bearing dorsiflexion, it creates tension proximally, thereby giving you an assistance to achieve terminal knee extension. This is one of the several reasons making our gait cycle so efficient. Since we're going to treat the gastrocs, we're also going to target the flexor hallucis longus and its important role to contribute to lower extremity function. To find the flexor hallucis longus, it attaches to the lower 2/3 of the fibula. So anywhere on the posterior aspect of the lower 2/3 of the fibula will create a treatment for the flexor hallucis longus. Find the fibula and palpate it through the lateral gastroc. Compress, spread your tissue, quickly tap. The needle is going to go through the lateral gastroc first, then the soleus, and once you reach the posterior aspect of the fibula, you will treat as well the flexor hallucis longus. Advance the needle slowly, monitoring for any adverse complaints from your patient. Once you get to the lateral aspect of the fibula, hold, secure the needle, let the tissue slide up the shaft of the needle so that it prevents you from displacing the needle from your desired target. With that needle indwelling, I can also treat the medial gastrocs, and then all three of these muscles, since they're all innervated simultaneously by the tibial nerve, I can connect it with electrical stimulation for the nourishing and restorative property of axonal transport. If you found these techniques interesting and like to learn more, please check out www.aspireomt.com for the course closest and most convenient for you. Thank you.